Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video chat. I am pharmacist, owner of Millennium Pharmacy, my website, themillenniumpharmacy.com. Please visit my website for medical devices, OTC products, merchandise. Please subscribe to this channel, like and share as well. I invite you to join me as I talk about inhalers as well as spacers and how to use these particular items in both pediatric, adolescents, and adults. So stay tuned. Okay, so we're jumping into this video. I am Dr. Erica Onigbola. I'm going to talk about inhalers. Inhalers are very important because they help with breathing treatments in acute situations, in emergency situations as well. I'm particularly talking about the albuterol inhaler for this particular video. There are also other actuation or punctuation type devices that carry other medications as well. So it is very important to understand how of using this particular device effectively and skillfully can help with bioavailability of the medication and so increasing effectiveness. Okay, so this particular device needs to be washed periodically. I would say every 2 to 3 weeks. The canister needs to be divided from the actual medication device, the plastic surrounding, and it needs to be flushed with warm or hot water to remove all of the medication that may be residue on the inside. So do be aware that, again, every 2 to 3 weeks, the canister needs to be removed from the actual plastic container. The canister needs to be removed from the actual plastic container and rinse with hot water. This removes residue that may block the actuation or medication dispensing. So do be on the know of that. Also, it's very important when using the inhaler, if you're going to use a spacer, to clean the spacer as well every 2 to 3 weeks. Rinse the spacer out with hot or warm water to flush the system so that medication can be uh, effective in the area where it needs to be, which includes in the upper bronchial tissues. Okay, so also, besides cleaning the actual canister, rinsing with hot water, rinsing the spacer is very important also to make sure that the medication is mixed and shaken. The suspension is shaken before use to mix the actual medication. Okay. Now, the medication is usually as needed therapy. It's not around the clock therapy. And when using the medication, it's very important to breathe out before use. Breathe out, insert the canister and the device inside the mouth. Make a complete seal around the mouthpiece. Punctuate the canister, the medication, and then hold and inhale very slowly for about 3 to 5 seconds. Hold the breath for about 10 seconds and then release. Okay, again, I'll repeat that. The best way to utilize the medication device is first to exhale completely, insert the canister or the plastic device inside the mouth, making a complete seal, and then inhale very slowly, breathe in very slowly after punctuating that canister. Hold the breath for about 5 to 10 seconds and then release. Okay, so once that is completed, that will make sure that the medication has gotten to the location of action where it can begin to dilate the bronchial tissue for healthier and more profound breathing. Okay, so this particular medication, canister, and device can be used with a spacer as well. The only difference is that the spacer will help pediatric patients with breathing technique. Once their breathing technique has become very skillful, they can remove the spacer and begin to use the device, the canister device, without a spacer and with a complete mouth seal. Okay, the Aero Chamber is an example of a spacer. It's a type of brand that is available through prescription, through the doctor's office, and can be dispensed in the pharmacy along with the inhaler device. Okay? Also, the spacer can be used with adults, especially those adults who need assistance with actual breathing. Now, spacers may be a little bit expensive, but they are beneficial. So I do recommend them as a healthcare provider. Also, the Aero Chamber inhaler comes in different sizes, small, medium, and large, to assist smaller individuals as well as adults as well. And do be aware that you're breathing evenly and deeply when using the inhaler device so that the medication can get back into the lungs where it will work. Okay? Avoid inhaling slowly, which is a mistake. These are inhaler tips. Also, breathe in through your mouth, not through your nose as well. Keep inhaling as you press down on the inhaler. So once you press down on the inhaler, you breathe in slowly, and then you also breathe in for that 5 to 10 minute or 5 to 10 second period. Press your inhaler only once while you're inhaling, one breath for each puff. And then you can also wait about 1 minute between puffs, which permits a second puff to be penetrated through the bronchioles. Again, you're going to wait 1 minute between puffs to make sure that the medication is getting where it needs to work. Okay, they are particularly recommended for young children, the spacers are, and other adults, especially adults who may need more of assistance. Okay, so Aero chambers and spacers are not only for pediatric, but they are also for adults as well. That is a common mistake, a common healthcare mistake, that only pediatric young adults or young kids can use this particular medication or device. And it can be used in adults as well. So do remember that. Also, rinsing and cleaning the device every 2 to 3 weeks is very important. Actuation or testing of the device is also very important as well before each use of the device. Again, that's going to be holding the canister in the air, pumping one spray to make sure the spray is actually being dispersed evenly and properly and not blocked by residue. If that is the case, go ahead, remove the canister, flush with hot water, replace the canister, and then begin the use of the medication if that occurs in any situation. Keep inhalers on hand at all times for emergency situations, which is best. Also, it's best to also make sure that the inhaler is in a clean, dry place, away from moisture and away from activities where it can be submerged in water. So do be aware of that healthcare tidbit. If there are any questions or comments, please let me know. I'm Dr. Erica, pharmacist. I usually see these prescriptions dispensed all the time, especially with our pediatric patients and with adults as well. The spacers, again, are available prescription only and are specific for size and age purposes. So do be aware of that as well. And they are covered by most insurances, Medicare and Medicaid. Check with your insurance, commercial as well, to make sure that these devices are covered for you. Thank you for joining me. I am Dr. Erica. Like, share, and subscribe. Have a great day.